Diabetes has a lot of symptoms, but mainly 3 stand out, which are the most common. And these are frequent urination, increased thirst, so you drink a lot of water, and then an increased appetite. In order for us to understand how these symptoms come about, we have to understand what diabetes is. And by definition, diabetes is simply an elevated blood sugar. Now, for us to know what elevated means, we need to know what the normal is. And usually in the hospital, we measure 2 blood sugars. One of them is a fasting blood sugar, which is measured when you fasted. You haven't eaten anything for at least 8 hours. And this figure should be in between the ranges of 3.9 to 5.5. When this figure goes above 7, we are usually considered as diabetic. Another type of sugar that we measure is the 2-hour postprandial blood sugar. So this one is simply you eat now and then we measure your blood sugar 2 hours later. We're expecting that your body would have normalized it by then. The normal range of this value should be less than 7.8. When you have a 2-hour postprandial blood sugar which is greater than 11.1, you are considered diabetic. To further deepen our understanding, I'll give you a very simple analogy of how we're going to link diabetes to insulin. Let's say you live in a house of, let's say, 8 bedrooms. And in these 8 bedrooms, you have 8 children. Let's say these children have the inability to leave their rooms to come to the living room to come and collect food. You always have someone who delivers it to them. Now, the person who's delivering this food to them is the mother. The mother always has food in the living room, but her job is to deliver it to the children. So coming back to our example, the mother in this case is our insulin, and the living room is the bloodstream. So the insulin has to be in the blood for it to move this food to your cells which are in the bedroom. And this is where the type 1 diabetes comes in. So 1 in type 1 diabetes is when the insulin is not being produced enough, so the food cannot reach the children. So remember, your mother is not around and then she can't give you the food. So this one is mother dependent, so insulin dependent. Type 1 diabetes is insulin dependent. You don't have insulin because your pancreas is not producing it. So the cells become hungry. The sugar keeps piling up in the living room. In type 2 diabetes, these are the more difficult ones, where everything is there and is provided, but when you take the food to the bedroom, the children are refusing it and then they end up being hungry. So remember, I mentioned the concept to say, think of every cell as though it's a human body. So if those cells are not receiving that food, they will give a picture to the brain as if they are actually hungry. And this is where the first symptom of diabetes comes in. The signal is going to be given by the various cells in the body that we haven't received anything, we are feeling hungry, please bring more insulin, eat more, increase your appetite so that you bring food here and then we can start to eat it. And that's where the problem comes in. So as a diabetic person, your cells are actually hungry, but the food is there in the living room. And that's where the complications come in. So that's just one, and that's the increased appetite. So how then does a person with diabetes end up urinating a lot? So think about this simply. In grade 8 and up to 12, we used to be told that water moves from an area of low concentration to an area of high concentration. Now, the 2 places that we're talking about here are your cells and your bloodstream. In your bloodstream, you have a lot of sugar, and water is going to move from the outside, from the cells, into your bloodstream, and your bloodstream will expand. So water will keep entering your blood vessels, and the one place that they have to go to when the water is too much is your kidneys. Your kidneys are going to remove the excess water, and guess where that's going to go? It's going to come out as urine. So you'll start peeing a lot because of that high concentration of sugar in your blood vessels. Now, these things, if you think about them, it's like a constant loop, because if you're losing fluid, you're urinating a lot, you become dehydrated. And when you're dehydrated, it simply means you need water. When you need water, your brain is going to be signaled to say, boss, here we need water, we're losing too much. Then your body gives you the sensation of having that thirst. So you start drinking a lot of water. So this will be a constant cycle that's going to be happening. First of all, you feel hungry, you feel thirsty, you drink water, you pass a lot of urine. This will just be a constant vicious cycle. And this is why when you come to the hospital, we give you medication in diabetes to do mainly 2 things. It's either we're going to give you insulin, which you are not producing, like in type 1 diabetes, so that the food can be moved to the cells which actually need it. And then in type 2, we're going to encourage those little babies that do not want to feed to actually feed, and then you're going to be okay. So that's basically what diabetes is and how these three symptoms come about. I hope this was helpful.